Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. Today, I had the opportunity to sit down with Dr. Ben Jauregui, who serves as one of the leaders of the Inland Coalition on Aging and also as the manager of integrated transitional care for Inland Empire Health Plan, which has over 1.5 million Medi-Cal beneficiary members in San Bernardino and Riverside counties. In today's episode, we learn about the influences of Ben's career, which were his parents, who served as migrant farm workers in the state of California, and just the impact that they had on him and what he saw as a child, and how that ultimately led him to become a leader in social work and serving those who are often less fortunate in the Inland Empire. We hope you enjoyed today's episode, where Ben shares a little bit more about the Inland Coalition on Aging and the development of the master plan for the Inland Empire that's modeled off California's master plan and other work of the Inland Empire Health Plan. We hope you enjoyed today's episode. Feel free to check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com, checking out our YouTube channel, or listening to us wherever you listen to your shows. Thanks, everybody. Enjoy today's episode. Dr. Jauregui, thanks so much for joining the show today.
Good morning, Gavin. Good to see you. Thank you for having me.
Absolutely. Good to see you as well. And I've had the chance.
Please call me Ben.
Oh, okay. Yeah, will do. Thank you, Ben. Had the chance to get to know you just a little bit over the last couple of years and senior leadership in the Inland Empire and throughout the state. So really appreciate you joining and the opportunity selfishly for me to get to know you better. But I know our audience is looking forward to it as well. So I think you mentioned you've seen a couple episodes before. And so, the first part of each show, we like to get to know the guest a little bit. So can you share with us preferably something outside of the workplace, like a fun fact, hobby, something like that?
Sure. So fun fact, a couple of years ago, I think maybe 3 or 4 years ago, I went out and bought DJ equipment and became a DJ.
So is this like professional DJ?
No, not necessarily. So, at work and various volunteer opportunities that I participate in, I find myself being the MC or being asked to be the MC, the host. And so very regularly, I need a microphone, I need a system, I need to play music for an event, an activity, a luncheon, a conference or whatever. And so I thought, I just might as well just buy this equipment, have it ready so I can always help out whenever it's needed, right? And so yeah. I went out and bought the equipment. I don't do it professionally, and I'm not for hire. In fact, everything I've done has been volunteer in the last couple of years. So I'll volunteer for activities at work, nonprofit organizations. I've done a couple of, community walks where they're walking to raise funds. I've been the DJ to play music. So I'm not interested in being a professional DJ, but I do enjoy volunteering my services to nonprofit organizations and a little bit at work. So.
That is awesome. Okay, so you DJ. How about, can you sing as well? Do you do any of that?
I cannot sing. I don't have a voice. I love to sing, don't have a voice. But yeah, DJing is just something fun that everybody enjoys, right? Everybody enjoys music. It livens up the event and activities, and people just enjoy a good playlist. And so that's what I do, provide the microphones or MC the event and or provide music.
Okay, do you mind me asking what are some of the songs you kind of lean on a little bit?
I play whatever is popular because people want to hear what is popular. They also want to hear a variety of music. It's never just one genre, especially at these community events. Nonprofit organizations are having a community event, a health fair. I recently did a health fair in Banning, Beaumont. It was mobile mammogram clinic. And so we were outdoors, lots of vendors, organizations providing services. And so I just played a variety of music, from country to pop music to rock to Motown music. I just find music that's popular, that was a hit at some point, and just play it, a couple of even some disco songs in there. People just
nice.
Enjoy them. I recently did another event at the Rancho Cucamonga Quakes. There was we held a health fair there, and so I just played some music, played some sports related music, but just whatever gets the people kind of dancing, as they're walking, visiting the booths, just liven up the environment.
That's great. And I've been to many events that you've hosted, so this makes sense to me. Some of our audience is not in the Inland Empire area or too familiar. So you mentioned the Quakes. They're a minor league baseball team, folks, affiliated with, do you know who they're affiliated with? Is it Angel?
The Dodgers.
Dodgers. Okay, well, it's this episode will be released in November, so we'll know how the Dodgers ended up by the time this episode is out. Great. Well, that's a great fun fact. Let's jump into your background a little bit, Ben. So we know you're a leader in the aging space in the Inland Empire, but can you tell us a little bit about your background, how you grew up, and maybe any mentors or influences that ultimately led you into healthcare and working with older adults?
Sure. So I grew up in Southern California, grew up in Calexico till I was about, Calexico is in the Imperial Valley, Southern California. Grew up until I was about 11 or 12 there and moved to San Jacinto. Lived in a couple of places. My parents were migrant farm workers, and so we moved around a little bit depending where the work was. And so we moved around, finally settled in the Highland, San Bernardino area. So graduated from high school in San Bernardino area, went to college here locally in San Bernardino, and I've been in this area of the Inland Empire since graduating from high school. So I'm currently living in Rialto, and so I went to school here locally also. Graduated with a doctorate of social work from California Baptist University and a master's in public administration from California State San Bernardino.
Okay, so you mentioned your parents were migrant farm workers. So can you mind me asking where their origin is?
Sure. My mom was born in Guadalajara, Mexico, and my dad was born here in California in Brawley, which is also in the Imperial Valley. And so they married and had some kids, and I'm the youngest of five. And at the time, they were working in Stockton, California. So I was actually born in Stockton, California. You know, when you're a migrant farm worker, you go where the work is, right? So some work was in Imperial County, but then the seasons change, and so you move according to where the work is. And so they happened to be working in Stockton at the time. That's where I was born, but then they moved back to Calexico, and that's where we stayed in Calexico for most of my early years, but my dad would still travel occasionally, wherever the work was. And so that was a interesting experience, and it kind of contributed to my field of work, I believe. Those experiences of the barriers that he faced working and doing his best to raise a family and make enough money. And migrant farm workers don't get paid their worth. They don't. And he also had a back injury on the job and was not able to work for a while. So seeing him struggle to get through, to get disability benefits, and then seeing him trying to get back to work, even though he was having back issues. My dad was a worker, hardworking man, and always wanted to get back to work. And he did go back to work and did a couple of things, but his back would always bother him again, so he ended up back on disability. So seeing all of those challenges that I saw him go through, I think kind of led me to the field of social work. That's my background. And helping to remove those barriers that I saw people experience. And also growing up low income. We grew up very low income, but I don't know that I knew it at the time. There was hints that we were lower income when I would see, the new houses being built across the street, and they looked really big and fancy, and the fancy cars. I think that's where you start to notice the difference in upbringing. But my parents were wonderful parents, and I wouldn't have it any other way. But you definitely go through some things and see the differences in lifestyle and the barriers that people face trying to make a living. It's challenging when the resources when you don't have all the resources. One thing I remember clearly was if my dad had to travel out of town for work, he took the car, and if there's no car, there's no, going places, and if you needed to go to the doctor, you had to kind of plan things accordingly to the access to a vehicle. We only had one vehicle. And so little things like that, I think, really led me to see the challenges that people face who are low income, people who have disabilities, and trying to live on SSI, supplemental security income. It's just a challenge for families and it's a challenge for people to break that system and break out of poverty also. Yeah. And so I think that also inspired me to work hard and make my parents proud.
That is awesome. And I bet they're proud. I do have to ask a little tangent. You mentioned your mom is from Guadalajara, so I'm a big soccer fan. Any Chivas connection or no?
No connections, no connections, but I enjoy watching occasionally.
Nice. I always have to try to sneak in soccer for those that listen to multiple episodes. They might notice a trend here, but yeah, I always try to sneak that in. That is really cool, man. And I'm sure your parents are proud of you, and having that lived experience, if you will, I know, as you mentioned, is definitely going to be influential. I have kids. My wife and I both work. We also grew up. Candidly, I probably had things a little bit easier than you did, but I was still like lower middle class, which I know is different. But I'm trying to teach my kids, and I'm curious, like, do you have children as well? And are they aware of like how their grandparents lived? And I'm curious your thoughts on that.
Absolutely. I have two boys, 19 and 21, and they know all about grandpa and grandma and their struggles. Grandpa lived with us for a while. My dad had dementia, and he moved in with us so I could provide some care for him. My boys were around him and helped out, and we were so blessed to have him with us for the last 5 years of his life. That's another experience, seeing the challenges that he faced with healthcare, with his own acceptance of his limitations, and having to deal with limited mobility, limited, ability to participate in all aspects of life. He had also had other medical conditions that really limited him. He had to use oxygen 24 hours a day, and that made it a challenge to get out, just to even the basics of going out and going to the store, get something to eat. I try to include him in as much as I could in family and life, and going out and shopping and doing things, but it was a challenge. And so a lot of learning happens when you have to go through these things. Having a background in social work, it's interesting. You think you're ready, you're helping people all the time, but then when it happens to you, it's so different. It's just different when things are personal and they happen to you and your family, because you have all the emotions attached to it, and just, stress or worry that, it's not the same as helping a stranger that walks in the door and helping them to find resources and navigate healthcare. When it happens to you, it's a little bit different, a little bit more challenging, but I'm glad I had the background and experience that I did to be able to help my dad, but I did the best that I could to help him and ensure that my dad was able to make his own decisions, yes, even up to the last, few days of his life, when he said, "Just take me home," and I brought him home on hospice. And that's one thing that I was very grateful for the in-home supportive services program, IHSS, that provides caregivers, that allowed me to assist my dad and help him to stay at home for as long as possible, because he wasn't one that was going to go to a long-term care facility. He made it clear, that's not for me. I want to stay home in my room. And so I did my best to support him and keep him at home for as long as possible with the help of in-home supportive services, IHSS. These wraparound services are critical for people and families, not only for the person with a disability and for older adults, but also for the family, right? To be able to support that person in the home, in the community, and keep him as home for as long as possible, and avoid that costly institutional care that, it's a great service for folks that need it. But if you don't need to be in a facility, I strongly believe you should not be in a facility. We should wrap around services around people. We should help them through providing wraparound services to support them in the home, remove barriers, and really just ensure that health is wrapped around and social services are wrapped around people so they can live at home, age in place. Right? Age in place is a term that we use to mean most of us want to age in place. I don't want to age and then have to move into a facility. I want to live here in my home, where I've raised my boys and have my pets with me and things like that. So
definitely. Really quickly, your pets, what do you have?
I have two dogs. I have a Chihuahua, a Chihuahua Winnie dog. His name is Dexter. My kids always named him Dexter. Chihuahua. And I also have a Yorkie Terrier. Terrier, and his name is Rocco.
That's awesome. I have two dogs, but they're much bigger. And my wife's like, she wants the small dogs like you have. So I think next time.
Yeah, mine are little, but they think they're big. They own the house. Yeah.
That is awesome. So you kind of talked a little bit about your beliefs around wraparound services, things like that. Let's backtrack a little bit into what you're doing today. So can you walk us through very briefly, how did you end up at IEHP, and talk about what like integrated care means at IEHP?
Sure, absolutely. Well, my current position is manager of integrated transitional care. I work in the utilization management transition of care department, and I have 4 teams. Their focus the main team is a team of nurses, social workers, and community health workers, and they help transition members out of hospitals. And so that's our goal, is to help members who are in the hospital, acute setting, or skilled nursing facilities, actually any care setting. If they're in a setting where they're receiving healthcare services and they're transitioning to home, transitioning from one level of care to another one, we want to make sure it's a safe transition, that they're going to transition, it's going to be a safe transition, and they don't end up back in the hospital. That's something that happens when we don't support people in their transitions from setting to setting, and we always want to support people in the lowest level of care where they can be at home. That would be the ultimate goal. How do we get people at home? How do we support them at home? How do we help them through that transition? How do we link them to services and make sure that they have those services when they get home, sometimes before they get home, make sure that hospital bed is home, the oxygen tank is there at home when they transition. And then also, what do they need in the home? Do they need a caregiver? Do they need a ramp? Do they need grab bars? And so I get the privilege of helping folks who are transitioning, going through a difficult, challenging time of their life, and we are helping them to transition and make sure that it's a safe transition. So I love the work of supporting not only our members, but the family, extended family that's caring for those folks also. So I also manage all the social workers in the department. So I have a team of social workers that help, that are assigned to various hospitals at all the local hospitals here in the Inland Empire. I have a team that helps with difficult placements. And so it's a challenge to find the appropriate level of care. It's a challenge because everybody's an individual. All transitions are individualized to that person, right? Every person has different needs, different preferences, different cultural, linguistic needs, and we have to kind of tailor every transition to them. And so some of these transitions can be a challenge. And so I have a team that's specially trained and knows how to deal with challenging situations and where do we find the best care. And this facility's filled, so we got to find another one that has available beds. So I have a difficult placements team that does that. And finally, I have another team called the long-term service and supports team that helps with home and community-based services. How do we support older adults and people with disabilities to live independently at home for as long as possible through care management, through caregivers in the home, through anything that's going to support them to live at home again, divert people from facilities, transition them out of facilities, hopefully prevent institutional placement in facilities. We always want to support people in their home and transition to the lowest level of care, the least restrictive environment. So that's our focus. Integrated, great question. Integrated means that all disciplines that it takes to provide whole person care are a part of this team, as opposed to having just a nursing team helping folks with transitions or having a social work team helping with transitions. It's critical that we have both services working together, because for the most part, most people do have a clinical need. They were just in an inpatient setting. They have medical needs that maybe we need to ensure that we provide as they transition home. Maybe they need, again, oxygen. Maybe they need appointments. Maybe we need to ensure that they see their primary care physician, linking them to specialist appointments and things like that. Therapies that they might need or follow-up appointments, we need to make sure. But we also need to address the social determinants of health, right? We find that many of our folks, especially in some areas of the county where resources are not readily available, where there is no available public transportation, or maybe there's a food desert. How do we address all those social determinants of health needs? So our social work team that's embedded in this integrated team can address all the health-related social needs. So that's what we mean by integrated. It's two disciplines, multiple disciplines. Our community health workers also are experienced and come from the community, and they know the community and can link members to community resources. So integrated means it's a team effort. It's multidisciplinary, and we're addressing the whole person, all of their needs, clinical, social, behavioral health also. And so we have all the disciplines working together.
That is awesome. You mentioned community health worker as well. And I've shared this with a few people outside of IEHP, and I've had the privilege of getting to know a few of the CHW leaders within IEHP. And folks, if you don't know about the work that IEHP is doing, not just with employing CHWs and using them as part of this integrated care team, but actually building up the new CHW workforce. It's really cool. We won't have time to talk about it today, but I encourage you guys. I see Ben nodding, of course, because he knows all about it. But I know in 2025, I believe there's some openings for folks to be trained as part of some of the cohorts. I think you guys are completed for 2024 from what I hear, but yeah, it's really cool. And I'm glad you brought up the community health worker team that you work with and have integrated into the work out with your IEHP members. So you did a great job explaining one of your hats and what you're doing over at IEHP in your day job. But as part of your work, you're also leading the Inland Coalition on Aging and helping to implement the Inland Empire's Master Plan on Aging. I'm just going to open it up, and I want you to share with our audience what the Inland Coalition on Aging is. And can you tell us about this master plan that I guess will be implemented starting next year? I know, correct?
Sure, absolutely. Well, as part of my role as the LTSS manager, long-term service and support, it's important that I stay connected to the community and the resources and our long-term services providers. And so being a part of that means being connected to community organizations, being a part of collaboratives and associations, just staying connected so I know what's going on in our space, but also to know those organizations that can help my members. I think that's the benefit of being connected to the community, being a part of these organizations, these coalitions, is that I know exactly who to call when one of my members needs something that's maybe community related, social determinants of health needed. I know exactly who to call if they need access to programs and services. And so that's the benefit of being connected to the community, being a part of it. And so a couple of years back, a colleague of mine said, Ben, there's this funding available for this coalition that we used to be a part of. There used to be a coalition called Long-Term Service and Support Stakeholder Advisory Committee many, many years ago. The committee kind of dwindled down, but the funding was still available. And she says, Ben, do you want to revive this? You know, what can we do with this money? And I said, yes, let's use that right now and start to see if we can develop an Inland Empire Master Plan for Aging. You know, a couple of years ago, Governor Gavin Newsom started the work for a California master plan for aging, and they've done tremendous work in gathering stakeholder input, gathering data, and making sure that we hear from the community, from stakeholders, from older adults, people with disabilities, caregivers. And all this information was gathered through many stakeholder work groups to develop a California master plan for aging. So I was involved in some of those committees I attended, and I was learning so much and seeing the power and the value of connecting with all these folks to address the needs in California that I thought we could duplicate those efforts. We can definitely do what California is doing as far as developing, getting stakeholders together, convening people. I know lots of folks here in the Inland Empire that serve older adults, caregivers, people with disabilities. And so I said, yes, let's use that money to bring people together. We called a meeting together, just emailed some colleagues and friends, and surprisingly, not surprisingly, we had about 250 people at the first meeting, close to 300 people attend the first meeting. And what that taught me, a very important lesson, was that there's definitely a need for us to work together to improve services for older adults, caregivers, and adults with disabilities in the Inland Empire. The response was so amazing that I thought, wow, we've really got the support of the community. Let's make sure we continue this process. And so we did. We continued those meetings. We developed some subcommittees, some committees. We developed a board of directors, and I'm the board chair right now. I have a treasurer who is the executive director of Inland Caregiver Resource Center. So Carmen Estrada, the director there, is on my board. She's the treasurer. I have a secretary, board of directors member. She's with a disability advocacy organization. I also have the director for the Riverside County Office on Aging and the assistant director for the San Bernardino County Department of Aging and Adult Services on the board. And I did that very strategically. The people who we picked and we invited to be on the board were folks who could definitely make an impact in the Inland Empire countywide, brought them together, started meeting regularly, started gathering input, and really started to focus on how do we identify what the needs are, what are the gaps in the Inland Empire. So we hired a consultant, and we've been working for the past 3 years now on developing this master plan for aging. We're very close to finalizing it. We hope to have it finished by June of this next year, but it's been a great process of meeting folks in the communities that they live, going out into the rural areas, into the certain groups that we identified as wanting to connect with and get their input to what the needs were. We went to the low desert, the high desert. And if you know the Inland Empire, we're a very vast, huge area here in Southern California. And we definitely wanted to ensure that we captured the voice of everybody in the community. So we visited some groups that were older adults at some senior centers. We visited some groups that represented adults with disabilities at some disability advocacy organizations. We went to Inland Caregiver Resource Center and talked to some caregivers, and we got their input. We put it in a document, a draft document. And the plan is to use this document, everything that we've learned about the Inland Empire, the needs, the barriers, the gaps, to develop a blueprint. So the Inland Empire Master Plan for Aging will be a blueprint that we can then share with elected officials, directors of departments of aging, departments that provide services to caregivers, county agencies, nonprofit organizations, social services agencies, health plans, hospitals, universities, anybody that's serving these populations or populations of focus, which are adults with disabilities, caregivers, and older adults. They can use this Inland Empire Master Plan for Aging to develop their programs, to see what the needs are in their community, and then know who the players are in the community so they can also connect. We plan on having some more convenings and to make sure that these folks, these agencies are connected and working together to continue to move the needle with the goal of ensuring that we have integrated services, that we have folks working together to improve the Inland Empire so that we can all age well. So that's our vision, is an Inland Empire where everybody can age well.
Well, I appreciate that as a wealth of information, and you were able to put it nicely in a clear, concise, and compelling way. I have family. I'm actually a resident just outside the IE, but I do have family in the IE, and we're all getting older. So you're setting us up for success and my family up for success out there. So really appreciate it. One quick comment for our audience that may not be familiar with Inland Empire Health Plan. So Ben wears many hats. You're also with the California Commission on Aging. You have a role there too, correct?
Correct.
Yeah, so you can see Ben's doing a lot. And one thing about Ben that's a reflection of, I think, IEHP leaders as a whole is really just that community, that facilitation, but you do it in a really warm way. And you guys open up your doors for the community often, literally open up your doors to host events. And folks from your CEO down, you make yourselves available. Jared is your CEO. I mentioned singing earlier to see if you sang like he does. I mean, he kind of remembers my name. I'm just some, of the thousands and thousands of people he probably interacts with. It's just that warmth, that IEHP, that you, Ben, even though I don't know you too well, like you just give off this warmth, but you're also a leader with authority. And it's a cool balance that you guys are able to figure out. So just a quick shout out, folks. If you work in the IE, if you do business or a resident, get to know IEHP. The membership is over 1 million members that are being impacted. Is it close to 2 million now? I should know this better.
1.5 million members.
1.5 million. Yeah. So growing. I've had family as IEHP members. There's really something special there at IEHP. So
absolutely. I have to thank our leadership, of course. Jauregui McNaughton is our CEO, and he has a strong connection to the community. We're a public health plan. I don't know if folks know that Inland Empire Health Plan is a joint powers agency, a public entity. We were created by the Board of Supervisors for San Bernardino and Riverside County. They created us to deliver Medi-Cal benefits. So now we have 1.5 million members in the Inland Empire. So we have a Medi-Cal line of business, a Medicare dual special needs plan, and we just started providing covered California benefits. But definitely, leadership understands that we need the community to support our members in their health and to live well and to really heal. Our mission is to heal and inspire the human spirit, and we cannot do it with our community partners. And so we definitely value our partners, and that's why we're involved with the Inland Coalition on Aging and other organizations, statewide organizations, local organizations. We need their help, and we definitely support them in their efforts and what they're doing. So just appreciate all the partners that we have, and thank you for being a partner with us and joining us at our conferences and events at IEHP. We're definitely a convener of local organizations that are doing good work in the Inland Empire.
Yeah, very true. And then everything you guys are hearing today, I know you might hear different podcasts and leaders talk and see all the right things, but IEHP is living it. So again, just want to show my appreciation. So we talked a little bit about the Coalition on Aging and the master plan, and hopefully having that finalized in 2025. Backtracking to your work, that is part of your work at IEHP through the LTSS arm of the many hats, or I guess, I said arm, but hat, whatever, the many things that you do there. Any initiatives around CalAIM? That's a big word. People also use the phrase Medi-Cal transformation. Is there anything that you wanted to share with the community that's listening in about how you and your department and the CalAIM initiative, how that's looking going into 2025?
Oh, very excited to share about CalAIM, especially the community supports and enhanced case management. But I'll share a little bit about community support since that's what my team is involved with. So CalAIM, a Department of Healthcare Services initiative to improve, advance, and innovate Medi-Cal, develop these new services called community supports, and where the goal is to really support people where they are, to meet them where they're at, to make sure that they have the services and supports, both medical and social services, that they need to prevent costly institutional care, to prevent the further deterioration of their health and advances of their disease, and just prevent rehospitalizations, and really address homelessness also. Community supports is our 14 services that are meant to really support our members, especially those that are highest in need, but the high utilizers, folks that have very multiple chronic conditions, folks that are experiencing homelessness, and folks that are in institutions and they want to get out and they need the assistance of community supports to help them to transition out. So I'll name a few. We have a housing trio of services called, we call them housing trio because there's 3 different types of services that can help people to find housing, keep housing, and really exit, either prevent homelessness or really sustain the housing that they have and find housing. And so housing transition navigation services help people find housing. If somebody is in need of housing, they're unsheltered or maybe just transitioning or want to transition out of a facility like a skilled nursing facility, we can connect them to services. We can pay for these services to help them to successfully identify a place to live, whether that be an independent living setting, whether it be a residential care facility for the elderly, or that be just a home on their own, an apartment that they can find. We can help link them to a vendor, an IEHP contracted vendor, who can then help them find housing, safe and stable housing, so we can avoid homelessness and help those who are at risk of losing their housing. So housing tenancy and sustaining also is another program that helps people maintain their housing if they're struggling to keep the housing. Tenancy and sustaining can help them by linking them to somebody who can help them maintain that house. Maybe it just takes a little bit of advocacy to ensure that they have enough benefits, enough income to maintain, to pay the rent. Maybe it's a little bit of advocacy coordination with the landlord to ensure that they can stay where they're at, or just finding additional services, benefits, employment that can help them to ensure that they have the ability to maintain their housing. And so, and also transitioning services. I think I mentioned that a bit. We can help people divert people from long-term care. So let's say they're at risk of being placed in a facility. They need a higher level of care. They're not able to stay in the home. any longer. Maybe they need a residential care for the elderly, residential care facility for the elderly. We can actually help them find a facility and help them get into that facility. And we pay for part of the services. The member still has to pay the room and board portion of it, but we would pay the other services that help to keep them safe in the home, the assisted living services that they receive in the home. So that's good for diversions, to divert people from long-term care, but it's also good to transition people out of long-term care. So we've used those benefits to transition people who have been in facilities for a while, or maybe just a short amount of time. They want to return back to the community. We can help them to get back to the community, back with family, back into the community where they used to be, or maybe a new residential care facility for the elderly. But CalAIM has been amazing help to really help people to remain in their home and avoid institutional care. Many years ago, I remember when I first started in this field, we didn't have these services. It was hard to divert people, transition people out. We didn't have the funding resources. So it was very limited what we could do. We could try to help them apply for a waiver program. And waiver programs are great, but they have limited slots. And so there was long waiting lists. Now somebody calls us, they qualify for our services. We can quickly, if they're eligible and meet criteria, we can approve it and quickly start to provide them services. For example, we can also pay for caregiver services. Years ago, if somebody needed a caregiver, we would help them apply for in-home supportive services. That's a caregiver that provides caregivers in the home. Now, we can actually get them a caregiver quickly, right away, within a couple of days, as soon as they need it, so they can make a safe transition home. And then we can also help them apply for IHSS so they can continue and get a permanent caregiver in the home. But we didn't have that prior to CalAIM and community support. So CalAIM and community supports has really helped us to help people to quickly transition out of hospitals, to quickly transition out of skilled nursing facilities, or prevent those costly institutions. And so it's also helped us to help people who were experiencing homelessness. And so this has been a great help to thousands and thousands of our members. And I'm just thrilled to finally see the day where we can really make an impact and help people to find the best level of care that they need, that they choose in a community setting, not necessarily in a costly institutional setting. So yes, I can't say enough about community supports. It's been a big help.
Awesome. And great examples there of the housing trio and transition services. So Ben, really appreciate you being on the show today. I know you're wearing many hats. You have lots to do. You have family, you're DJing for not-for-profits on the side. You are a man of many talents, and I really appreciate the chance that you've given our audience and myself to get to know you a little bit better today. Your stories about your parents and how you, not only they served you as a child, but how you especially served your father. Really helps me better understand why you're so passionate about what you do. I've been attending events with you for a couple of years, and I see the passion, I see the joy, and I didn't know the why behind it. And you've given us a peek behind the curtain of the why, and it's pretty cool, man. So if folks want to connect with ICA, Inland Coalition on Aging, can you share with us that website, Ben?
Sure, inlandaging.org. Inlandaging.org. It's easy to find and easy to register. If you'd like to register to be in the know of what's going on with the Inland Empire Master Plan for Aging, or if you're a professional working in the field, anybody working, serving populations, the older adult community, where adults with disabilities or caregivers, we welcome professionals. Membership is free. You can sign up on there and get updates as far as what's happening with the Master Plan for Aging, what's happening in the space of these populations and these organizations that are serving these folks, and know about upcoming conferences, meetings. And we just had a fantastic conference recently. We had about 250 professionals in the room, and we had elected officials there, and great turnout and great support from the community. And we just provided an update on the Inland Empire Master Plan for Aging. Everybody's excited about where we're at, how long we've come in getting that stakeholder input and writing this document. And we're excited next couple of months to really publish that Inland Empire Master Plan for Aging. So thank you for allowing me to share this information about the Master Plan for Aging, the Inland Empire Master Plan for Aging. I think it's going to have a huge impact here in the Inland Empire. So thank you, Gavin. Appreciate it.
You're welcome, Ben. And folks, some other places to stay connected with the Medi-Cal world and the Inland Empire. They have what are called Path Collaboratives. There's a third-party group called HC2 that helps facilitate those. So definitely reach out to myself. I know Ben makes himself available as well, the Inland Coalition on Aging, to reach out about the different events that will help you also connect with IEHP. So Ben, thanks again for joining the show today. Really appreciate it.
Absolutely. Thanks, Gavin.
Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.